Mi nombre es Maritza Jiménez. Soy parte de los fundadores de la organización Fundación Todo por la Salud, Funto Salud.
My name is Maritza Jiménez, one of the co-founders of Funto Salud, Fundación Todo por la Salud, which started as a group about 30 years ago, but the incorporation happened about 20 years. And this community, we found people of Haitian migrants and Dominicans who were not able to access services that were only accessible in the big cities, but unfortunately those people cannot get to those cities. Mainly with the Haitian migrant population, because of their migrant status, many of them not even intend to reach the medical services. What we saw was a situation where many of them were dying because they weren't able to reach a medical facility to get taken care of. The situation worsened and some of them just were dying. Since then, Fundación Todo por la Salud was founded because of that. And one of our objectives is to provide quality medical services to this population that's been disenfranchised in the Dominican community. So we carry out these services because of their situation in the Dominican Republic. We then took the work from the batallas and expanded it to the border of Haiti and the Dominican Republic, specifically in the northern side of it, because that was an area that was abandoned, given to the situation that it was the fortress on the north. Since the south get more services and they're able to access services easier because both capitals are nearby in the south. So given that the northern side of the border was an abandoned area, we extended the services. In the 70s, when I was studying at the UAS, the University Autonomous of Santo Domingo, medicine, by 1975, we were already, as a student, working in hospital and just looking at how people, because of the social condition, how they were treating, what they were going through. Back then, when you are out in the field, hearing about a Haitian patient, that was something strange. And we would hear cases that they wouldn't dare to come into the hospital and they would even die in their own home, wherever they were living, because they couldn't come into, the facilities to get medical services. As a professional, having all this privilege, having all this access to things, and then looking at this population not able to access medical services in the shadow because they were afraid and they couldn't access to what is so primary in a people's life, health care. How can that be? Me as a professional, becoming a professional, and these human beings going through this. Many of them know only that they didn't have the resources to get the care that they needed, but they were afraid because they were afraid of being deported back to Haiti. So how this can be, I asked myself. Back then, we didn't know the reality of Haiti. We were foreign to what was going on in Haiti. We only knew about the situation of the one living there in the batallas and of the one in the Dominican Republic, but we didn't know anything about Haiti. So we decided to extend the services to the border. We decided to make this bigger. When I speak about we, I mean my family, friends that believed in what I wanted to do. Because I believe a project is not a one-man show. I believe a project grows and is a reality because people get together and make it happen. So yes, I was able to bring more people on board because I saw the necessity of the Haitian brothers and sisters in the Dominican Republic. I saw the need and I saw how difficult it was for them to access what they needed to access, how much difficulty because of the language, because of the status. And back then, they were not a population that nobody cared about understanding their situation. And that necessity I saw, and I brought more people on board. Fortunately, now there are more organizations that are trying to change that population is not disenfranchised anymore, and organizations like Funto Salud that are trying to work on that. But definitely, this work is that I saw that necessity. There was a necessity and I act upon. Up to now, some of them are collaborators. They do when, something in there that's there. Some of them were my classmates. Others, they joined us along the way after the foundation was actually an organization. In the Dominican Republic organization, they call it foundation. But it's not the same meaning as here. I just wanted to clarify that. So going back to her voice, some of them, they're there as collaborators. And back then when I started doing the work, they would say that I was crazy. That why was I doing that for that population? they call me crazy. And some other were speculating that I probably had some interest, some personal interest or benefit that I was getting out of it. But you know what? I continue doing the work. Call me crazy, even if they call me whatever. I continue doing the work.